Hi, my name is Bob Quinn. I'd like to welcome you to this CE certificate program in the treatment of chronic Lyme disease. In this program, you will learn the herbal strategies developed by Heiner Fruehauf, a PhD, as he delved into the ancient goose syndrome literature. And you will hear Dr. Chris Metro, who's a naturopath as well as an acupuncturist and herbalist, go through cases from Heiner Fruehauf's Haishan clinic. Dr. Metro has worked there, a very long time. And he, more than anyone, understands how Heiner modifies formula from visit to visit. You'll hear me go through my ideas of how to use acupuncture and other therapies to treat chronic Lyme. And you'll hear Daniel Silver go through how we use moxibustion to treat chronic Lyme disease. I want to say that this whole certificate program is very important to me. I myself have twice, once for 3 years, once for 2 years, been severely ill with chronic Lyme disease. And so now when a patient comes to me and says, I went to the supermarket with my husband, I had to be in bed for 3 days from that, I know what they're talking about. I experienced that degree of depletion and fatigue. So for those of you who are choosing to work with this population, it's a big challenge. It's actually tough on the ego many times because this is a very perplexing condition that's in so many different body systems. It's in the bladder, it's in the heart, it's in the joints, it's in the nervous system, and so on and so on and so on. So that there's so many symptoms bouncing all over, and it's very, very challenging to get these people back to a point of health. But it's possible. And if you do what's in the certificate program and you practice the skills that are taught and you really integrate what Heiner lectures about, and you learn how things are modified formula to formula to formula from Dr. Metro, you will be able to help patients that maybe currently you can't help. And I will say these same strategies, and maybe the herbal strategies would change, but if you go to other patients who are very, very depleted, multiple chemical sensitivity or fibromyalgia, people who are not chronic Lyme patients, but who are very ill and very depleted, a lot of these same treatment ideas are going to apply and are going to help you help them. My prayer is that those of you who complete this whole program, you're able to help people who are in the condition I was in. So that instead of 3 years to get back to a basic degree of wellness, maybe that could have, with help, I could have done it in 1.5 years. And the second time, instead of 2 years, maybe with some help, it would have been 1 year. That's my prayer, that this is not just a money-making proposition, for the CE company and for the teachers, but that it produces an improvement in the clinical outcomes, and that the patients benefit. So with that, I'll thank you for participating and wish you good luck employing these new strategies and techniques in your practice with chronic Lyme patients. Thanks for your attention.